Well, what about, oh, I know what the last one was. The last one is elevated PSA. All right. So now let's say if we had the same list of answers, but now we have a bone X-ray that looks like this. And then we do a biopsy. Anybody know what this is? What would you call this? Does it look like normal hematopoietic marrow? No. All right. Let's go on. These are your choices. 50-year pack year, smoking history, the history that you'd expect for that biopsy, history of childhood chest and neck radiation, recent history of flank pain and hematuria, increased back pain for 2 years, and recent onset of anemia, and vague abdominal pain with elevated PSA. Okay, so now you get to choose. Go ahead. A 1. Come, There we go. 5, 4, 3, 2, 1. Ah! The same 37. Well, thank you anyway. All right. You got it right. Or you would have gotten it right. No, actually, you didn't. I'm sorry, guys. Okay. 4. They're very good. Okay. 50-year pack smoking history and meiosis of the left pupil. That is a lung cancer, all right? Now, you could have a metastasis that showed those malignant glands, which is what was in the histology, all right? But did you notice, let me go back and see if I can go back. Do you see this? Oh, actually, we can go forward eventually, but on this x-ray, those are osteoblastic metastasis, multiple bone metastasis, and they're making extra bone. There's only one thing that looks like that, and that's metastatic prostate cancer. Now, most cases, if there were holes in bone, multiple holes in bone, it could have many, many things. It could be a metastasis from any carcinoma virtually, but that kind of osteoblastic is prostate cancer until proven otherwise. All right? That's the reason I could give you that question. All right. What about history of childhood chest and neck radiation and enlarged thymus? What kind of tumor is that a good history for? A thyroid carcinoma. Do you remember Chernobyl? Okay, the radiation disaster in Russia with major papillary cancer. All right, that's a characteristic picture of that. That would be multiple radiolucent metastasis. Recent history of flank pain and hematuria. What would be good cancer for that? Renal cell carcinoma, and that's the one that has the increased red cell mass. Do you see I have the same list of tumors? I've just given you different things. I've given you x-rays, I've given you histories, I've given you other clinical phenomenon, paraneoplastic syndromes, all for the same group of tumors. And so you can ask an infinity of questions about the same group of tumors. And there's lots of ways you can do that. That's how you manipulate these questions. Increased back pain for 2 years and recent onset of anemia. That's pretty much our first case, our myeloma. All right? And then vague abdominal pain. Most people actually, the major reason for this are his metastasis, because people with prostate cancer don't usually have any pain. All right? But so there's multiple ways. And again, we could have asked a much simpler series of questions. What does this represent? And then you would have gotten them. Small cell carcinoma of the lung. I just could have made that up. I could have said that that wasn't because those were glands. All right, thyroid cancer, renal cell carcinoma. But we made it harder, a second level question, by having to know the answer and then go and get it. And that's the way that works. Okay. Other bony questions, I won't spend any more time on this, except to know that outside of metastasis, there are very few things you need to know about bone. Okay. In cardiovascular pathology, You will hear lots more about that clinically, and there's so much cardiac pathology. Dr. Tenner will talk to you about pharmacology, and he is a very good cardiovascular pharmacologist. He knows more than you'll ever want to know about cardiovascular physiology, okay? That's where a lot of your questions will come from. But pathology, you'll probably get something congenital. You'll talk about being able to tell a left to right shunt from a right to left shunt. Okay, so you need to know that the left to right shunts all have Ds in them. ASDs, VSDs, PDAs, all right? And which one of these, right or left to right, left to right or right to left, presents with cyanosis in childhood? Right to left, okay? So they're going to give you a child who's either cyanotic or not, at which point you'll need to know, you'll be able to figure out which of the congenital heart diseases. That's the way that that will present if they're going to give it to you. All right? Atherosclerosis, probably they could do a pathology question, but they'll probably give you something clinical about that. Here's a trichrome stain of a photograph of the heart. This is a photomicrograph of the heart. What is your diagnosis? Acute bacterial endocarditis, a myocardial infarction after 1 day after it started, a myocardial infarction after 90 days, subacute endocarditis in chronic rheumatic heart disease, or pericarditis at 10 days. Some of these are fairly obviously not what we're going for, so hopefully everybody will get this right. Okay, why don't we go? Oh, you want the picture back? Okay, can we go back? Oh, well, okay, we'll do it one more time after you go get to see the picture. Ah, okay, let's go back. What does a trichrome stain show? What is the green stuff? It's fibrosis, exactly, it's collagen. Okay, if there's this much collagen in the heart, why don't we give it another chance? One more time. Can we do it another time? Yeah. There we go. So all of that green stuff was collagen in the heart. Oh, 42, 49, 54. All right, see? All right. Yeah, now, I do know that some of you went along with the last answer, but that's essentially a scarred heart. And when you talk about scar, all that stuff, that general boring stuff in pathology, you need to know that scar took some time to form. So if somebody injures their heart with ischemic necrosis, it's going to take 3 or 4 days for that scar to even begin to form. And it's going to take weeks and months for it to finalize. So for it to look like that, it had to be more than a few days old, all right? And all the others, the itises, you'd all expect neutrophils and lots of other cells in there. So this is scar tissue and heart tissue. So the only thing it could really be is a very old MI. 40% of medical students in the United States could not recognize this picture. Okay, on an exam that was like an exam we give to pathology students. So those of you who didn't get it are within good company, or necessarily bad company. But the point being is that this didn't mean that you just needed to know. They would have told you you need to know about a trichrome stain. It's one of the few special stains you need to know about. But you'd need to know normal histology, that this is not normal histology, and the only way you get this amount of scar in the heart is to have an MI, and that it takes some time to put that together. So it's a lot of things you need to know to answer a relatively straightforward question. Okay, this is a better picture. It looks better over here. This is a more acute one, where that looks redder here, because this is the area that's been affected by an occlusion in the left anterior descending artery. All right, and now this is early on. So this is leaky blood vessel, so it looks redder, and it hasn't fallen apart yet. It's a very early MI. All right, and probably within the first day or so, you'd end up with some very subtle changes where your cells just begin to fall apart. Okay. Let's stop for about 5 minutes, and we're behind, but that's the way it's going to go. And so if you want to take a little bit of a break, I'm just going to get some water and we'll come right back, okay? And then we'll go to 5 o'clock.